Buspirone. You've probably heard the name pop up if you've ever looked into anxiety treatments. But, what is it really? And how is it so different from other medications you might be more familiar with? Well, let's dive in and break it all down. So, this is the big question we're tackling today. And honestly, the answer is key to understanding where this medication fits into the whole landscape of anxiety management. Getting this right helps you have a much smarter conversation with your doctor. All right, here's our game plan. We're going to start with the absolute basics. Then we'll take a look at how it actually works inside your brain. Of course, we'll cover side effects and how to take it safely. And finally, we'll see how it stacks up against some of the other options out there. Okay, first things first. Let's start right at the beginning. What exactly are we talking about when we say Buspirone? Simply put, Buspirone is a prescription drug for treating anxiety disorders in adults. Now, you'll see this word anxiolytic, which is really just a fancy clinical term for a medication designed to help reduce those tough symptoms of anxiety. The constant worry, the tension, all of it. One thing to know is that you'll only find this as a generic medication called Buspirone. The original brand name, Buspar, isn't on the market anymore. And just to be super clear, generic drugs have to meet the exact same super strict standards for safety and effectiveness as the brand name. So you're getting the same quality, and usually it costs a lot less. Okay, now for the really interesting part. Let's get into what makes Buspirone so different, because its approach is not what you might expect from an anxiety med. So think of your brain as this incredibly complex communication hub. Serotonin and dopamine are like key messengers that help regulate your mood. What Buspirone is thought to do is help fine-tune the activity of these messengers, helping to bring things into a better balance, which, over time, helps dial down those feelings of anxiety. Now, this timeline is so important to understand. This is not a quick fix. You see, it starts working on a chemical level right away, but you might not feel the full benefit for 2, 3, or even 4 weeks. That's when it really hits its stride. Knowing this up front is absolutely key. And that brings us to this crucial point. Buspirone is what we'd call a maintenance medication. You have to take it every single day for it to build up in your system and work properly. This is not the kind of pill you take as needed when you feel a panic attack coming on. It just doesn't work that way. All right, let's talk about what's on everyone's mind when starting something new: side effects. We're going to cover both the common, mild stuff and the rare but serious things so you know exactly what to look for. So a lot of people might experience things like dizziness or an upset stomach at first. And yeah, it can be a little unpleasant. But here's the good news. For most people, these side effects are pretty mild, and they usually fade away within a couple of weeks as your body adjusts to the medication. Okay, now for the serious stuff. It's rare, but you need to know about it. Serotonin syndrome is a medical emergency. If you start experiencing things like hallucinations or a really fast heart rate, that is a call your doctor or go to the ER right away situation. No hesitation. Same goes for any signs of a major allergic reaction. So, with all that in mind, how do you take Buspirone the right way to make sure it's both safe and effective? Let's walk through the key rules. Your doctor is going to follow a simple but really effective principle: start low and go slow. They'll begin with a small dose and then gradually increase it over a few days or weeks. The goal here is to find the sweet spot, the absolute smallest dose that works for you, which helps minimize those side effects. Okay, everybody, listen up, because this is the single most critical safety warning. You absolutely cannot take Buspirone with a class of drugs called MAOIs. The combination can cause a really dangerous spike in blood pressure or lead to that life-threatening serotonin syndrome we just talked about. That's why there's a strict 2-week waiting period. It's non-negotiable. And here are 2 other things you'll need to steer clear of: grapefruit and alcohol. It sounds a little random, but grapefruit can actually interfere with how your body breaks down the medication, which can crank up the side effects. And alcohol, well, that's just going to make any dizziness or sleepiness a whole lot worse. Okay, so now that we've got a really good handle on Buspirone, let's put it all in context. How does it actually compare to other well-known anxiety medications?
Let's put it head-to-head with Xanax, a drug almost everyone's heard of. Now just look at that bottom row under warnings. For Xanax, you see an FDA-boxed warning. That is the most serious alert the FDA can issue. It's a huge red flag for significant risks of misuse, addiction, and dependence. Risks that Buspirone just doesn't have.
And that brings us to the biggest difference of all. Drugs like Xanax are classified as controlled substances for a reason. They have a known potential for dependence and misuse. Buspirone is not a controlled substance, and for many people, that is its greatest strength. It offers a way to manage anxiety without that risk of addiction hanging over your head. So that leaves us with a final question, and it's one you can really only answer for yourself. When it comes to managing your anxiety, what's a better fit for you? Is it the slow and steady, non-addictive approach, or is a faster-acting option, even with its potential risks, a better choice? It's a really important conversation to have with yourself and, of course, with your doctor.